morning, everyone, and welcome to Thank You, Doctor. Now, for this week's episode, we will have a special guest who really flew here to the States from Australia. Let us all welcome Dr. Keith Pido. Dr. Pido here says that he is a very shy person, but I bet once he opens his mouth and speaks, we will all be amazed by his wisdom and intellect. Okay, so I believe that we wouldn't want to wait any further. Let us all give it up for Dr. Keith Angelo Pido.
Okay, so the urinary system is the major excretory system of the body. The kidneys are beinged organs. The renal capsule surrounds each kidney. Medial to the kidneys is the hilum, which is where the renal artery and nerves enter and where the renal vein, ureter, and lymphatic vessels exit. The kidneys are also divided into two major regions, an outer cortex and inner medulla, which together lies. Calyx, a funnel-shaped structure, surrounds the tip of each renal pyramid. Calyx's renal pyramids then form a larger funnel known as the renal pelvis. This renal pelvis also narrows to form a small tube called the ureter. The kidney has approximately 1.3 million nephrons, which is the functional unit of the kidney. Each nephron consists of the renal corpuscle where blood is filtered.
Doctor, may I please ask what the loop of Henle is? I want to know more about it.
Of course. So the loop of Henle consists of two regions, a descending and ascending limb. The papillary duct. There are two types of nephrons in the kidney, the juxtamedullary and the cortical. The juxtamedullary nephrons take about 15% of the nephrons and have loops of Henle that extend deep into the cortical nephrons, which dominate 85% of the nephrons. Corpuscle is the filtration portion of the nephron. It consists of the Bowman capsule and the glomerulus. The Bowman capsule is the enlarged portion of the nephron, while the glomerulus is a tuft of capillaries that look like balls of. Now, finally, let's move on with the ureters. The ureter is a
I, hello. Sorry guys, I'm late. Yeah, sorry.
Sir?
Ay, tayo sa, namdi ko sa States. Sorry I'm late, brothers and sister. I am your Dr. Ran Sabillano. You can call me Doc Ran. And I'll be talking about the male reproductive system. Yes.
Oh yeah, Dr. Sabillano. We were still planning on having your lecture next week, but please make yourself comfortable. We will still try to finish Dr. Pido's lecture first about the urinary system.
Oh, okay. Sorry, Doc Pids.
Okay, so the ureter is a tube that carries urine from the kidney to the urinary bladder. There are two ureters, one attached to the kidney, and each ureter is about 10 to 12 inches long in the average adult. The urinary bladder is a hollow, muscular, and pear-shaped, distensible, elastic organ that lies on the pelvic floor. In the body of the bladder, urine is stored, while the fundus is the base of the bladder. The ureter is a tube that carries urine from the urinary bladder to the outside of the body. The internal ureteral sphincter is formed by the junction of the urinary bladder, urethra, and smooth muscle. It prevents urine leakage from the urinary bladder, and the external ureteral sphincter is formed of skeletal muscles that surround the urethra as it expands through the pelvic floor. It allows a person to voluntarily start or stop the flow of urine through the urethra.
So the human species cannot survive without their reproductive system functioning. This system plays an essential for
Dr. Sabillano. I will be introducing you to the audience first.
Oh, I apologize.
So, ladies and gentlemen, this is Dr. Ran Sabillano from the Philippines. And and he will be talking about the male reproductive system. You may proceed, doctor.
Okay. So, the reproductive system is important for production of gametes, fertilization, development, and nourishment of new individual and production of reproductive hormones. But I'll be talking about the male reproductive system. So, number one. So, the scrotum. Yes, the scrotum. The scrotum is the loose pouch-like sac of skin that hangs behind the penis. Special muscle in the wall of the scrotum allow it to contract, relax, like cooling, like that. Number two. So, ladies and gentlemen, the testes. Yes, the testes. So, the testes are oval organs about the size of very large olives that lie in the scrotum. So, it secures at either end by the spermatic cord. Most men have two testes. Within the testes, collide masses of tube called the seminiferous tubules, which are responsible for producing sperm cells. Number three, so the epididymis. So the epididymis is a long coiled tube on the backside of each testicle. So it carries a store of sperm cell and created in the testes. So the vast difference is a long muscular tube that travels from the epididymis to just behind the bladder. Number four, the urethra. So yes, the urethra is the male urethra is a narrow fibromuscular tube that conducts urine and semen from bladder and ejaculatory ducts. And lastly, the penis. I think everybody knows what's the penis, right? So the penis is the male sex organ reaching its full size during puberty. So the penis is made by several parts. So the glands or the head of the penis, corpus are the two columns of tissue running along the sides of the penis. Blood fills this tissue to cause an erection. And lastly, corpus spongiosum is a column of a sponge-like tissue that fills with blood during an erection and keeping the urethra open.
Wow, you're also very much filled with wisdom, doctor. But may I ask what the glands involved are?
Yes, sure. You may now also listen to the answer to your question. So the prostate gland is a firm, dense structure below the urinary bladder. So the secretion of the prostate are thin, milky colored, and alkaline. So meanwhile, the paired bulbourethral or the Cowper's gland are small, about the size of a pea, and located near base of the penis, so below the penis.
Oh, okay. Thank you so much, sir, for the discussion about the male reproductive system.
Wait, there's more. So the seminal fluid or semen is a slightly alkaline mixture of sperm cell and secretion from the accessory glands. Yeah.
Wow, once again, doctor. Indeed, these systems are truly interesting, like our guest over here. The next part of the next part of our segment is supposed to be an open forum. However, I believe that we do not have enough time. Airtime anymore. We will all see you next week instead. Here in Thank You, Doctor. Good morning, everyone.